Well, welcome back to On Location at GPRMC. Today we're visiting the pharmacy, as you can see here. So come on, let's go in and take a tour. We have a lot of security here in the facility, specifically the pharmacy, because we want to control these drugs here. So we've got a safeguard system that doesn't allow certain people in. And so what we'll do is, if we can get in here.
Press the button.
Apparently I don't have the proper security clearance. We'll see if my key works here.
Sorry.
Well, there's Cindy.
Yes.
Well, Cindy, now my key doesn't work.
Well, you know, you're entering a very secured area, and not even the CEO has access to the pharmacy department.
Not even to check out compliance or nothing?
No. You can only get in if you're a pharmacist.
Well, that's good.
So,
That's good for safety.
We've got lots of them here. So.
Super. Well, this
Yeah.
is Cindy Way, the director of the pharmacy, and Cindy's going to give us a tour today and check out the pharmacy. So you ready to roll?
I'm ready to roll.
All
Are
right,
you?
let's do it.
Kim is our clinical pharmacist, and she spends her day thinking deep thoughts right here. And she also monitors patient drug therapy and calculates doses.
So when you're dosing, does it depend on a person's weight, and how do you do that?
Weight, height, age, renal function.
That means kidney?
Kidney function.
All right.
Yep.
So how do we make sure we have the right dose and that somebody doesn't
How do
make
we
a mistake?
Well, we actually do now have a calculator that we can do on the computer. Yep. Plug all that data in, and it gives us a recommended dose.
Super. Well, thank you, Kim.
Sure.
Thank
Not
you.
a problem.
Jackie is basically in charge of keeping the levels of medications in the Pyxis machines, deciding on the inventory levels, deciding where to put them in the various spaces.
We're going to have you log in
Okay.
as if you're the nurse
Do I have to log in?
and remove some medications.
My mom's a nurse. Does that count?
So,
No.
okay, we
All
are
right,
going
we
to
made it.
remove medications on Eclipsis Med. So you're
Okay.
going to go to remove.
And
go
this
ahead
is
and
the
just,
touch screen?
Yes, it's touchscreen. The list of medications that you see are all of the meds that have been
Is that
verified.
bell for nap time, or what is that?
I think so. We better break.
Is it cookie time in the pharmacy, or what's?
What you selected is a controlled substance. So when this drawer pops open, it's going to ask you to enter in the beginning count of all
Okay.
of the medications that are in there. So you're going to want to take out
All of them, or
all
just?
of those and
All right.
count them.
Now, what is this? What kind of drugs are these?
So now go in and tell it you want some of the acetaminophen.
Okay.
Hit remove selections. These are another type of the drawers that we have that are secure
Now,
drawers.
how did it know to do that one?
It's only going to open up the QB that has the medication in
Wow.
it that you need. Now you've got your medications to administer to the patient, and the patient's been billed for them.
Super. Where were we up to next, Cindy?
Okay, well, we're going to go to the IV room.
Okay.
We need to get an IV down to ED right away.
Okay, so Jim, where are we going?
We're going into the clean room, which is the ante room, and then the clean room is actually the IV room.
Okay.
All right, so we got to get some protective equipment on.
Yes. What we're going to do, we'll go in and I'll get a vial of water and I'll give you a syringe. You'll draw the water out of there and put it into here.
Okay.
And that will simulate making an IV. Now poke the needle in the sterile water, hold the sterile water upside down.
Like so?
Yeah. Geez, you're good.
You got any job openings back there?
So the next thing we're going to have you do is package some medication with Valen.
This area back here is where we do our packaging, and we keep all of our stuff that we unit dose, the items like the Tylenol and that kind of stuff. Also, it's where we unload like our medications that come in. Our freezer items are back here.
Like
And then-
Skittles, does that count as a medication?
Well, today it is.
Do we need to quality control these? Test them or not?
You better.
We should?
You should.
Is that blue thing clean?
Yes, we
Sterilize it?
sterilize it every time after, so we don't mix meds.
It seems fine.
Okay, good.
That's good. So it's putting them in a little package.
Okay, so see the names on there?
Oh, cool. Skittles.
Yep. And there we are.
What we do is verify that all the information on the order is correct for the patient, and perhaps John can explain it a little further.
Sorry, you can't run that camera while I'm in here. I'm on a witness protection program. I can't be photographed at this time. I'll talk to the U.S. Marshals. You can tune in on any Wednesday at 8 o'clock.
That's right.
I'm there. What we do is actually go on into the patient and pull those patients up, and then based on our orders, we go in and we verify the order. So what happens once I verify it? It goes in, it prints off the label. I just place it over here, and one of our technicians will fill that order. And then she's our double check. Then once she places the label on the order, she brings it back to the pharmacist, who double checks what she pulled against the label. And then we send it up to the floor.
We're gonna go to the to OB.
Okay.
Put some stuff in there.
Maybe we can hit the gift shop on the way back. Does that sound good? So we're going to 3.
Yes. Actually, we have a joke in the pharmacy that we do exercises while we're in here, but we didn't realize that we were on camera in here. So I'm sure security got a pretty good laugh at us at times. We do lunges and, you know, on the bars.
Afternoon, ladies.
Hi.
Good. How's it going? We have a delivery. So is that it for that one?
Yes.
All right.
Thank you, Greg, for stopping by the pharmacy today. We're all about patient safety, so we're glad to have the opportunity to show what we do.
Absolutely. Well, it's evident that we take our job seriously here in the pharmacy and very much safeguard the medications and make sure that they get to the right person and the right dosage and the right time. Well, that's a wrap for today on Location at GPRMC and the pharmacy. We certainly enjoyed the time we spent with the team here, and we're very much looking forward to next time when we visit Environmental Services. So thanks for joining us. We'll see you next time.
As you can see, we have lots of experts in drug therapy and in
Are those two
many other
talking to
things.
each other on the phone?
Right.
They could just lean over and...
Actually, yes.
Wave then.
Yeah.
You gotta wave.
Can you do the queen wave?
I see you almost found the last ace on the solitaire game there.
I did.
Is that a CME program for pharmacy?
It is. You know.